The first topic that I'm going to do is a very simple one, the Kwashiorkor versus Marasmus. All right. Now, a lot of you must have just rote memorized it. Okay, Kwashiorkor is protein deficiency, Marasmus is calorie deficiency. I want to clear a core concept of you. All right. First thing that we have to understand as far as Kwashiorkor and Marasmus is concerned, that they both are severe forms of protein energy malnutrition. Both are severe forms of protein energy malnutrition. Both are severe forms of protein energy malnutrition. Now, one of the reasons I specifically chose this topic was because a lot of you will be having this wrong concept. I would actually want to call it a wrong concept that there is protein deficiency in Kwashiorkor and there is calorie deficiency in Marasmus. This unfortunately is unfortunately a slightly outdated concept. It's a slightly outdated concept. The actual concept goes something like this. In both Kwashiorkor and Marasmus, the body and the child essentially has not been eating for a very long time. They're malnourished, severe form of protein energy malnutrition. बहुत time से कुछ खाने को नहीं मिला. For a long period of time, they have not eaten anything. Now, the core difference between Kwashiorkor and Marasmus lies where is the loss of protein occurring from. There is protein loss in both. Remember, both are protein and energy malnutrition. In Kwashiorkor, the protein loss is of visceral protein. All right. In Kwashiorkor, the protein loss is of visceral protein. It is of visceral protein. Now, a lot of you, and as far as Marasmus is concerned, in Marasmus, the loss is of somatic protein. The loss is of somatic protein. Now, what do I mean by that? In our body, protein is actually there in two different compartments. They're in two compartments. One compartment is the visceral compartment. Visceral compartment is your albumin. It is your enzymes. It is your neurotransmitters. This visceral protein is basically what? It is your albumin. It is your enzymes. It is your neurotransmitters. While somatic protein is a protein which is present in the muscles. Somatic protein is the protein which is present basically where? In the muscles. All right. Now, when the child was faced with the malnutrition, the body decided that it has to lose protein because body was not getting anything, right? Now, depending upon whether the body decides to lose visceral protein, that it starts to lose albumin, it starts to lose enzymes, it starts to lose neurotransmitters. If the body starts to do that, the child will end up having Kwashiorkor. Versus if the child body decides to lose actually a somatic protein, the protein there that is there in muscle, the child will end up having what? Child will end up having marasmus. And you can easily remember it by a simple that M for marasmus, M for muscle protein. All right. And this is the core difference between Kwashiorkor and Marasmus. In Marasmus, if there is loss of visceral protein compartment, think about it logically. Okay, think about it logically. If the chart is open, can you tell me which protein compartment will be more important? Which protein compartment will be more important for which protein compartment will be more important for survival as compared between visceral and somatic? All right, which will be more important for survival? Do you need these enzymes, neurotransmitter or albumin more, or do you need muscle more? And everyone here is correct. It is the visceral protein which you require more for survival. You need these enzymes for survival. You need the neurotransmitters for survival. You need the albumin for survival. You can still do with a little bit of protein, with a little bit of muscle loss, right? So this visceral protein, as everyone is typing here, and absolutely correct, this visceral protein is more important for survival. This is more important for survival, which is the reason in Kwashiorkor, when there is loss of visceral protein, the survival is going to be poor. The prognosis is going to be what? The prognosis is going to be poor. While Marasmus will have a better prognosis. If you lose all these neurotransmitters, what is going to happen? Will the child be will the child be normal? Will the child have normal consciousness? The answer is no. Child will become lethargic, right? Child will become highly lethargic. Child will become what? Child will become highly lethargic. Right. Well, in case of marasmus, there is loss of somatic protein. So what will you see? You will see muscle loss from everywhere. You'll see muscle loss from here also. You'll see muscle loss from here also. Child will look famished, right? Child will look famished. All right. So in case, this is the core difference between Kwashiorkor and Marasmus. All right. So in case of Kwashiorkor, because there is what? Because there is albumin loss. What will have happened? If there is albumin loss, there's going to be water retention that will result in this ascites. If there is ascites over face, if there is edema over face, what kind of face will it be? It will be moon face. It will become moon. It will look like a moon. It will look like a moon, right? Contrast this with marasmus. Contrast this with marasmus. In marasmus, because you have lost everything, lost all the muscle from here, lost all the buccal pad of fat, what will happen? If you have lost all the buccal pad of fat, face will become like this. This is what is called as monkey face, right? Like a monkey, right? Also called as simian face. Also called as what? Simian faces. Also called as simian faces. All right, and there will be loss of muscle mass. So this is the core difference between Kwashiorkor and marasmus. As far as skin and hair changes are concerned, visceral protein, your enzymes are required for giving you color to the hair. Your enzymes are required for maintaining the skin integrity. That's why these skin and hair changes, they will be seen where? They will be seen in Kwashiorkor. They'll be seen again in Kwashiorkor. As far as hair is concerned, you'll see what is called as a flag sign. You'll see what is called as a flag sign. And in case of skin, you will see flaky paint dermatosis. You'll see flaky paint. You'll see flaky paint dermatosis. You'll see flaky paint dermatosis. You'll see flaky paint dermatosis. So you'll see flag. What is flag sign? Basically, like a flag, you will have normal pigmentation. Then you will have no pigmentation. And then you will again have normal pigmentation. So normal pigmentation, no pigmentation, and again normal pigmentation. So it looks like a flag. Dark, white, dark. So that's a flag sign. Why is it this pigmentation occurring? Because enzymes are not there. And if enzymes are not there, the proper pigment formation won't occur. Right? So this is you have to uh, uh, this is how you have to understand the difference between Kwashiorkor and marasmus. This is how you have to understand. If you understand one is visceral, one is somatic, every concept gets cleared. And let's write down the differences in the tabular format. All right. This is what you have to revise before the exam. Like, immediately one small revision before the exam so that on the exam day, you don't get this question incorrect. All right. So wasting, as far as Kwashiorkor is concerned, what is wasting? There is albumin wasting. There is what wasting? There is, just one second. There is albumin wasting. As far as marasmus is concerned, there is going to be wasting of the muscle protein. It's going to be muscle protein wasting. As far as appetite is concerned, Kwashiorkor, I already told you, child will not have any neurotransmitters. So child will become what? Lethargic. If a child is lethargic, what will happen to appetite? Will the child be able to eat anything? No. So there will be what? There will be poor appetite. There's going to be what? There's going to be poor appetite. As far as marasmus is concerned, marasmus, child has lost a lot of muscle mass, but the neurotransmitters are there. He has not eaten for 10 days. If you give him food, he'll be like, I want a lot of food. He'll be very, very voracious appetite. There's going to be what? Voracious appetite. As someone rightly pointed out in the comment section, there's going to be what? There is going to be voracious appetite. As far as appearance is concerned, child will be, like I said, child, no neurotransmitters, child will be lethargic in Kwashiorkor. In marasmus, child will be irritable. Child will be what? Irritable. Why irritable? He's not getting food. In marasmus, because visceral protein has lost, no neurotransmitters, child has become lethargic. Prognosis is poor as far as Kwashiorkor is concerned, good as far as marasmus is concerned, as we already discussed. As far as onset is concerned, Kwashiorkor is usually seen in children more than 1 year. This is a fact that you have to remember. Some small facts. Marasmus is typically seen in children less than 1 year. As far as deficit is concerned, I'm making you guys and telling you this, guys, because a lot of the times examiners are old. They have not updated their concept and they might ask you a question from an old concept. That's why I'm making you write it down here. As far as Kwashiorkor is concerned, the deficit is protein deficit. The deficit is protein deficit. As far as marasmus is concerned, the deficit is calorie deficit. It's a calorie deficit. It's a calorie. So making you write it down here, but you guys have understood. I hope you have guys understood that the main difference is not this protein and calorie. The main difference is where you are losing the protein from. Kwashiorkor, you're losing it from the visceral part. All right. And in marasmus, you're losing it from the somatic part. All right. If you understand this core difference, no question is going to be tough. Coming to additional features, in Kwashiorkor, the liver is going to be a little bit fatty, which is not the case as far as marasmus is concerned. Which is not the case as far as marasmus is concerned. All right. Now, moving on. The next thing I'm going to discuss, so we have discussed Kwashiorkor and marasmus, a really important topic. The next thing that I'm going to discuss is diarrhea and dehydration, particularly the management of diarrhea. All right. Again, a very small topic, MNCI management of diarrhea, but multiple. Sure, Dharan, I'll show this slide. You can take a screenshot of this slide. All right. let it come here. Yeah, you can take a screenshot of this slide, and this is something which you can revise. You can put it in. So a lot of students, what they do, another thing a little bit different from pediatrics, but something which can help you in exam. You can actually make 19 different folders, all right, of all subjects on WhatsApp. You'll get the PDF, Punema. You'll get the PDF, but right now just focus on understanding the concepts rather than thinking whether you get the PDF or not. All right. Now, what I'm basically trying to say is that one thing, this is a concept which was told to me by one of my juniors, and it's something which you can utilize for revision. You can have, before we move on to the next topic, you can have 19 different groups, self groups on WhatsApp of each subject, where you can put these screenshots, things which you feel are important of your incorrect MCQs. Sometimes it's possible that you might not be able to log on, or you're not able to use an app or something like that. You can put these screenshots there, and you know that these are the screenshots and these are the things that I have to revise just prior to 1 day prior to or 2 day prior to the exam. 2 day prior to the exam. All right. Now, coming to diarrhea and dehydration. We'll discuss diarrhea and as far as milestones are concerned. The reason I did not put milestones today was because milestone is a huge topic. So I'll talk a little bit about milestones. It's not that I won't, since you guys are specifically asked for milestones, a lot of people are asking about milestones. I'll talk about it a little bit later. But yeah, let's first focus upon diarrhea and dehydration. As far as diarrhea is concerned, remember that diarrhea, as far as management of diarrhea is concerned, the management of diarrhea is essentially management of dehydration that occurs because of diarrhea. It is management of dehydration that occurs because of diarrhea, and it is giving zinc. The second part of management of diarrhea is giving zinc. Why zinc? Because zinc improves epithelial. It improves epithelial integrity. It improves epithelial what? It improves epithelial integrity. So we give zinc because it will improve epithelial integrity. So what will happen? The duration of diarrhea will decrease. This improvement in epithelial integrity will decrease the duration of diarrhea. It will do what? It will decrease the duration of diarrhea. Now, zinc, the dose for more than 6 months, children who are more than 6 months, is 20 mg. It is 20 mg. While those who are less than 6 months, the dose is 10 mg. And it's given for 14 days in both. It's given for 14 days in both. All right. Now, coming to the dehydration management as far as IMNCI is concerned. So as far as IMNCI, what IMNCI does is that the dehydration that occurs because of diarrhea, it can be no dehydration, it can be some dehydration, or it can be severe dehydration. So child will come to you. You will clinically assess the child and say the child is suffering from either no dehydration, some dehydration, or severe dehydration. All right. This is the previous page. Don't worry, I'll give the PDF to everyone. All right, we'll share the PDF with everyone. Don't worry about that. All right, don't worry about the fact that the PDF won't be shared. The PDF will be shared. Let's learn the concepts first. Now, as far as dehydration is concerned, IMNCI says what? That you can have a child has come to you. You'll say the child is suffering from either no dehydration, or some dehydration, or severe dehydration. All right, child could be suffering from either no dehydration, some dehydration, or severe dehydration. In no dehydration, the fluid loss is said to be less than 50 ml per kg. It's said to be less than what? It's said to be less than 50 ml per kg. In some dehydration, the fluid loss is estimated to be between 50 to 100 ml per kg. 50 to 100 ml per kg. All right. While in severe dehydration, the estimated fluid loss is up to 100, more than 100, equal to or more than 100 ml per kg. This is the estimated fluid loss. Because the actual fluid loss you cannot calculate. You don't know how many times the diarrhea would have been done. The exact volume you would not have measured, right? So this is just an estimate. All right. So child has come to you, you'll clinically assess, you'll classify whether the child is having no dehydration, some dehydration, or severe dehydration. If the child is having no dehydration, you will assume the fluid loss is what? Less than 50 ml per kg. In some dehydration, you will assume the fluid loss to be between 50 to 100 ml per kg. And in severe dehydration, you'll assume the fluid loss to be more than 100 ml per kg. You don't actually measure the fluid loss. This is an estimated fluid loss. All right. Depending upon the clinical condition of the child, this is the estimated fluid loss. You cannot actually measure the actual fluid loss because you don't know how many times the child has actually, the exact number of time the child has actually gone to the stools. You're not taken the volume of the stools, whether the stool was 100 ml, 300 ml, 500. So you cannot actually measure the fluid loss. This fluid loss is always an estimated fluid loss. This fluid loss is always an estimated fluid loss. Depending upon the clinical condition of the child, after you have assessed the child, clinically determined whether the child is having no dehydration, some dehydration or severe dehydration, then you will estimate the fluid loss to be between this. In no dehydration, you will estimate the fluid loss to be less than 50 ml per kg. In some, you will assume it to be or you'll estimate it to be between 50 to 100. And in severe, you'll assume it to be at least 100 or more than 100. All right. All this is a theoretical calculation. All this is a theoretical calculation. All right. As far as classification is concerned, like I said, the classification of dehydration will be into no. It will be into no, some, or severe. Now, IMNCI says depending upon these four clinical criteria, you will classify into no, some, or severe. No, some, or severe. First is consciousness. In no dehydration, consciousness will be normal. All right. In no dehydration, consciousness will be what? It will be normal. There is no dehydration, so nothing is going to happen, right? In some dehydration, what will happen to consciousness? Now, because the body has lost water, child will want water. Child is not getting water. So child will be very what? Child will be very irritable. Child will be what? Child will be very irritable. And in severe dehydration, child would have lost so much water. So much water would have gone from the body. What will happen? Child will become lethargic and comatose. Child will become lethargic or comatose. Comatose means child can be unconscious also. As far as thirst is concerned, in no dehydration, again, the thirst is going to be normal. In some dehydration, child is irritable. Why is child irritable? Child is not getting any water. That's why the child is irritable. So in some dehydration, child is going to be very, very thirsty. Increased thirst. There is increased thirst. Drinks eagerly. He will drink the water very eagerly. Why? Because he was not getting any water. That's why now when he has water, he will be like, give me more water, give me more water. In severe dehydration, what will happen? Child is lethargic, comatose. Do you think he will be able to drink? No. Unable to drink. Unable to drink. All right. As far as skin pinch is concerned, in no dehydration, skin pinch will be normal. In some dehydration, skin pinch will be slightly delayed. It will be delayed. And in severe dehydration, it will be very delayed or severely delayed. Severe dehydration, severe delay. In case of eyes, in no dehydration, eyes will be normal. Eyes will be normal. In some dehydration, eyes will be sunken. They will, sunk inside. In severe dehydration, they'll be very sunken. Again, severe, so very sunken. Very sunken. Very sunken. All right. It will be very sunken. Now, again, I'll explain it to you. In no dehydration, consciousness, again, no dehydration means child is normal. So consciousness will be normal. Some dehydration, you have lost some amount of water. So child will become irritable. He wants water. He's irritated because he's not getting any water. He is what? He's irritated that he's not getting any water. Right? That's why in some dehydration, irritable. In severe dehydration, you have lost so much water. Child has become lethargic or comatose, unconscious. Okay. As far as thirst is concerned, in no dehydration, again, thirst is going to be normal. In some dehydration, he was irritated. Why? Because he's not getting any water. Now, if you give him water, what will he do? He'll drink that water very eagerly. In severe dehydration, what will happen? Child was what? Child was comatose. Child was unconscious. If you give him water, do you think he will be able to drink? An unconscious person cannot drink. So, unable to drink. That's why unable to drink. The rest are easy. Skin pinch is going to be delayed. It's going to be delayed in some dehydration. It's going to be very delayed as far as severe dehydration is concerned. All right. And as far as eyes are concerned, in some dehydration, in no to everything is normal. In some dehydration, eyes will be what? They will be sunken. And in severe dehydration, they'll be very sunken. They'll be very sunken. All right. Now, with this information, let's understand the management. So now we know How do you classify dehydration? A child has come to you, you will clinically assess the child, and then you will say whether the child is suffering from some severe or no dehydration. If any two out of the four is there, you'll say what? You'll say child is suffering from, child is suffering from that particular part of dehydration. You'll say the child is suffering from that particular part of dehydration. Okay. You're suffering, say, that particular part of dehydration. All right. If let's say the child is lethargic or unable to drink, rest is, skin pinch is delayed, eyes are sunken, two out of the four of severe is being met, you'll say the child is suffering from severe dehydration. Two out of the four of severe is met, you'll say the child is suffering from severe dehydration. So any two out of the four, you'll classify the child into that particular category. You'll classify the child into that particular category. Okay. Now, with this knowledge, let's understand what is going to be the management of dehydration. Plan A is the one which is used for no dehydration. It is the one which is used for no dehydration. In no dehydration, what do you have to do? Do you have to rehydrate? No. You'll just replace ongoing fluid losses. You'll do what? You will only replace ongoing fluid losses. जब जब पतली पॉटी होगी उसको replace करते जाओ. Okay, because it was being used in no dehydration. Now, whenever the child is having a loose stool, you are going to replace that. So you are going to do what? You are going to give ORS. You're going to give ORS with each loose stool. How much? 10 ml per kg. 10 ml. How much? 10 ml per kg. So child has a loose stool. Child has, let's say, a loose stool. When the child has a loose stool, you'll tell the parents, give him ORS. How much? 10 ml per kg. So for example, let's say there was a 10 kg child. Let's say there is a 10 kg child. He has come to you. You understand that the child is not having any dehydration, no dehydration. You'll give the parents a packet of ORS. You'll say, mix it with 1 liter of water. Every time the child has a loose stool, give the child what? Give the child what? Give the child 100 ml of ORS. Give the child 100 ml of ORS. Give the child what? Give the child 100 ml of ORS. That's it. Every time the child has a loose stool. So child has a loose stool, give him 100 ml of ORS. Another loose stool, give him another 100 ml of ORS. That's it. So you're just going to do what? You're just going to replace the ongoing fluid loss. That's it. You're just going to replace the ongoing fluid loss using what? Using ORS. That is plan A. That is what? That is plan A. Okay. Moving on to plan, a little bit about ORS, a little bit about this ORS, a little bit about this ORS. This ORS is made up of sodium, glucose, potassium, chloride, and citrate. Sodium and glucose are equal. Both are 75 millimole per liter. Potassium is 20. Chloride is 65. Citrate is 10. So that the total osmolality is 245. Total is what? Total is what? If you add all it up, it will be 245. It will be 245. Moving to the management of, there is no role of antibiotic. No antibiotic. Someone asked antibiotic? No antibiotic. As far as plan B is concerned, plan B is used for what? Plan B is used for some dehydration. 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 In some dehydration, there is some dehydration. Now you have to rehydrate. How will you rehydrate? By giving ORS. Child is drinking water eagerly. So give him that a lot of water. Right? So now he will rehydrate. How much? The approximate fluid loss I told you was from 50 to 100 ml per kg. It was between 50 to 100 ml per kg. So you'll give exactly the middle of that. You'll give 75 ml per kg. You will give 75 ml per kg over 4 hours. You'll give 75 ml per kg over 4 hours. So approximate fluid loss was between 50 to 100. So you give that much amount of fluid you have to replace. You have to rehydrate. How much? 75 ml per kg over 4 hours. What will you give? You will give ORS only. Child is drinking, right? So you'll give ORS only. How? Oral. In case the child is not able to drink because he's vomiting a lot, then NG can also be given. Either oral or NG. So you'll rehydrate with 75 ml per kg over 4 hours. ORS only. Either orally or NG. Either orally or NG. All right. So this is the correction you will give. This is a dehydration correction because child has lost between 50 to 100 ml per kg. You will rehydrate that child, get him back to normal. Moving to plan C. Remember, plan C is used for severe dehydration. It's used for severe dehydration. In severe dehydration, the most important thing that you have to remember, child is what? Unconscious, lethargic, comatose. He can't drink water. The child cannot drink water. If he cannot drink water or cannot drink ORS for that matter, can you give him oral fluids? No. You have to use IV fluids. You have to use IV fluids because child cannot drink anything. Which IV fluid? RL with 5% dextrose is the preferred one. This is the most preferred one. RL with 5% dextrose. Ringal lactate with 5% dextrose. Over RL, over NS. This is the sequence. This is the sequence. First, you will prefer RL with 5% dextrose. If that is not available, for example, then you'll use RL. If RL is also not available, you'll use NS. RL is ringal lactate, NS is normal saline. All right. How much? Now the question comes, how much? So I told you what? I told you that the minimum amount of fluid, I told you that the fluid that you have to give, the replacement fluid that you have to give is going to be equal to the approximate fluid loss. So approximate fluid loss was equal to at least 100 ml per kg or even more than that. So you have to give at least 100 ml per kg. How much do you have to give? You have to give at least 100 ml per kg. All right. So you'll give what? You'll give 100 ml per kg. You'll give 100 ml per kg. This 100 ml per kg of IV fluid is given in two different parts. It's given either as 30 ml per kg. That is the first part. Then the second part is 70 ml per kg. Then the second part is 70 ml per kg. If the child is less than 1 year old, this first 30 ml per kg, is given over 1 hour. The remaining 70 ml per kg is given over 5 hours. If the child is more than 1 year, then the first 30 ml per kg is given over half hour. It's given over just half hour. The remaining 70 ml per kg is given over 2.5 hours. So that the entire 100 ml per kg, this entire 100 ml per kg, is given over 6 hours in a child less than 1 year, and it's given over just 3 hours if the child is more than 1 year. This is plan C. So you have to give 100 ml per kg, first 30 ml per kg over 1 hour, remaining 70 ml per kg over 5 hours. Which IV fluids? RL with 5% dextrose. Which IV fluid? RL with 5% dextrose. So I'll summarize it. This is the thing that you have to remember. Plan A, the fluid was ORS. The fluid was what? ORS. How much were you giving? 10 ml per kg with each loose stool. You were giving what? You were giving 10 ml per kg with each loose stool. There was no time point. Whenever there was a loose stool, you are going to give it. That's it. In plan B, you are still using ORS. This time you can give orally or NG also. What amount? What is the amount that you should give? This time you have to give 75 ml per kg over 4 hours. All right. In plan C, this time you have to use IV fluids. Which one? RL with 5% dextrose. What is the amount? You have to give 100 ml per kg. Either over 6 hours if the child is more than 1 year. If the child is less than 1 year. Or over 3 hours if the child is more than 1 year. So this is summarizing your dehydration management. This is how we summarize the management of dehydration. And zinc is given in all the cases. I told you in the very beginning, management of diarrhea is 2 parts, management of dehydration plus zinc. So zinc is common to all the 3. For all the 3, zinc is common. To all the 3. All right, zinc is common to all the 3. Now, a lot of you are asking me about Holiday-Segar formula. What is this Holiday-Segar formula? So this is the Holiday-Segar formula is the reason why you guys can get confused. The Holiday-Segar formula is the reason why you get confused. Till now, what we have discussed, remember, till now what we have discussed is dehydration. Dehydration का मतलब क्या है? Child is dehydrated. पानी कम हो गया. Dehydration means the पानी has gone down. उसको हम लोग फिर से normal लेकर आ रहे हैं. The water has gone down. We are getting the water status back to normal. Child was hydrated, then became dehydrated. We are taking the child back to normal. This is dehydration management. This is dehydration management. The next thing that comes is maintenance fluid. The next thing that comes is maintenance fluid. Now, what is the concept of this maintenance fluid? The name itself is telling you maintenance. This is the fluid required to maintain you. This is a fluid required to keep you alive. We say now on a daily basis, someone should drink 2 to 3 liters of water. We say this, right? On a daily basis, you should drink 2 to 2.5 liter of water. That 2.5 liter of water is this maintenance fluid only. That is the maintenance fluid for adults. On a daily basis, you should drink 2 liters. What is that? That is a maintenance fluid. It is a fluid required to keep you alive. It is the fluid required to keep you alive. It is a fluid required to maintain your body, to maintain your body. It is the fluid required to maintain your body. It is the fluid required to maintain your body. Right? And I'll tell you one statement that will make this maintenance fluid very easy as far as this entire concept is concerned. There is no relation of maintenance fluid with dehydration. Very important to understand. Very, very important to understand. There is no relation whatsoever of maintenance fluid with dehydration. This is the fluid which everyone will require. This is the fluid that I require. This is the fluid that you require. This is the fluid that a 10 kg child requires. This is a fluid that will require irrespective whether the child is dehydrated or not. There is no relation of maintenance fluid calculation. There is no relation of maintenance fluid calculation with dehydration. This is the fluid required to maintain you. This is a fluid that you require on a daily basis. It has no relation whether the child is not dehydrated, some dehydrated, or severe dehydrated. Has no relation whatsoever. This is the fluid that you require to sustain yourself, maintain yourself, keep you alive. इसका डिहाइड्रेशन से कोई लेना देना नहीं. तो डिहाइड्रेशन के क्वेश्चन में मेंटेनेंस फ्लूइड का कोई लेना देना नहीं. इफ दे आर आस्किंग यू अबाउट मेंटेनेंस फ्लूइड, यू डोंट हैव टू वरी अबाउट वेदर इट इज नो डिहाइड्रेशन, सम डिहाइड्रेशन और सिवियर डिहाइड्रेशन. Severe dehydration child also requires maintenance fluid. Some dehydration child also requires maintenance. It is required by everyone to survive in the 24 hours. This has no relation. What is maintenance fluid? Fluid required to keep you alive for 24 hours. The fluid that you required on a daily basis. That's why it is called daily maintenance fluid. That's why it is called as daily maintenance fluid. Now, how do you calculate this daily maintenance fluid? It is calculated with a formula called Holiday-Segar formula. It is calculated with a formula called Holiday-Segar formula, like some of you talked about. Now, this Holiday-Segar formula says for the first 10 kg, the fluid is taken as, for the first 10 kg, the fluid required is ml per kg. It is what? 100 ml per kg for every kg in what? In 24 hours. In 24 hours. Because it's daily maintenance fluid. Daily, right? For the next 10 kg, that is from 11 to 20 kg, it's given as 50 ml per kg. Per kg. All right, it's given as 50 ml per kg. Again in 24 hours. Again in 24 hours. And after the 20th kg, every kg maintenance fluid is calculated as 20 ml per kg. It's calculated as 20 ml per kg. Again in 24 hours. I'll give an example. Let's take an example. A child is 15 kg. Child is 15 kg. So for the first 10 kg, we have to calculate as 100 ml per kg. So 100 into 10 is equal to 1000. 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 Now 10 kg is done, 5 kg is left. 5 into 50. Because for the next 10 kg, it is 50 ml per kg. So 5 into what? 5 into 50. This is 250. So the maintenance fluid will become what? 1250 ml for a 15 kg child. For a 15 kg child, the maintenance fluid will become what? It will become 1250 ml. It will become 1250 ml. All right. I'll take another example to make it even more clearer. I'll take another example. Now let's take a example of 22 kg child. Let's take an example of 22 kg child. So this 22 kg, first 10 kg. First 10 kg is what? 100 ml per kg. So 10 into 100 is equal to 1000. Next 10 kg is what? Next 10 kg is what till 2050. So 10 into 50 is what? 500. Now till 20 I've reached. After 20, every kg is 20. So how many? 2 kgs are left. So 2 into 20 is what? 40. So add all this up. Add all this up. This will become what? It will become 1540 ml. So this will be the maintenance fluid that will be required in 24 hours for a 22 kg child. That's how you calculate it. That's how. And how much you have to give it over how much time? You have to give it in 24 hours. You have to give it what? In 24 hours. You have to give it in 24 hours. This is the daily maintenance fluid. Like I said, I'll again emphasize this is daily. This is a fluid that you require on a daily basis. This is a fluid that you require on a daily basis, right? So this 1540 ml needs to be given over entire one day, over 24 hours. In the last calculation, when we calculated 1250, that had to be given over 24 hours. That had to be given over 24 hours. Yes, you can do it like this. What Muhim is saying is absolutely true. That is another way you can do. That is another way you can do. From 11 kg, you can go 1000 plus 15 to 20, 15 into kg, and the rest you can go 1500 into. You can do it that way also. I find it that you need to go into core concepts, and that's why this is, I personally feel, is better. But what Muhim is saying is also true. You can do it that way also. You can do it that way also. Right? So how much fluid is required? What is the time point for this? It's 24 hours. It's daily maintenance fluid. It is daily. You need to give over the entire day. This is the fluid that you will require on a daily basis. And it has, again, like I said, it has no relation to dehydration. It doesn't matter whether the child is not dehydrated, some dehydrated, or severe dehydration. It has no relation whatsoever to dehydration. This is something which every single one of us, this is something which every single one of us, meaning you, that particular child that we are talking about, requires on a daily basis. It has no relation. It has no relation. It has absolutely no relation whatsoever to. It has absolutely no relation whatsoever to. It has absolutely no relation whatsoever to what you do, the dehydration status of the child. Sorry, I think it got a little bit disconnected. Sorry for that. All right. We move further. Now we'll discuss some MCQs. Now we'll discuss some MCQs. It's audible now? It's audible now? All right. It's audible. Thank you. Thanks a lot, everyone. Now we'll discuss some MCQs. Now let's discuss some MCQs related to this topic. Now let's discuss some MCQs related to this particular topic. A 7-month-old child presented with 18 episodes of loose stool and 4 episodes of vomiting. He is irritable but drinks water. Treatment. This is a previous year question. Now think about this logically. Although the answer is given here, think about it logically. He is irritable and drinks water. So this is what? This is some dehydration. This is what? Some dehydration. Irritable child means some dehydration. In some dehydration, you were giving what? ORS. You're giving ORS 75 ml per kg over 4 hours. So answer here has to be ORS. You will not use IV fluids. You will not use IV fluids. Why? Because IV fluids are used only in severe dehydration. They are used only in severe dehydration. So here it is what? It is some dehydration. So use only ORS. Use only ORS. You'll use what? Only ORS. Child is what? Child is irritable. So this is what? Irritable means child is suffering from what? Some dehydration. Some dehydration means ORS. Some dehydration means ORS, right? Now, coming to the next question. Tell me the answer to this question, everyone. Tell me the answer. A 5-year-old child weighing 17 kg, weight is what? 17 kg, has come with diarrhea. What is the amount of maintenance fluid required in 24 hours? Tell me the answer to this question. Child is what? 17 kg. What is the maintenance fluid required in 24 hours? Everyone is absolutely correct. So like I told you, maintenance fluid has no relation whatsoever. Maintenance fluid has no relation whatsoever to dehydration or diarrhea. This is the fluid that you require in a 24 hours. This is the fluid that you require in 24 hours, right? So here the child is what? Child is 17 kg. So first 10 kgs, it will be 10 into 1000. 10 into 100 is equal to 1000. Next 7 kg, it will be 7 into 50, that will be 350. That will be, so total will be 1350 ml. And everyone is absolutely correct. The answer is going to be option C. It's going to be what? It's going to be option C. It's going to be option C. Moving on to the next question. Next question that I'm going to discuss. What is the accurate statement about the condition depicted in this image presented by a child? So can you tell me what is this? First of all, just tell me, even if you don't look at the answer. This is what? This is Kwashiorkor or Marasmus? This is Kwashiorkor or Marasmus? This is Kwashiorkor. You can easily see the pot belly. You can see the ascites. You can see the ascites. And you know this ascites is occurring. Why? Because there is protein loss. Because there is visceral protein loss. There is albumin loss. So answer, immediately we can rule out option C and D. This is not marasmus. And Kwashiorkor, if we have to answer, occurs because of protein malnutrition. The visceral protein is lost. All right, so correct answer here is going to be option A, as everyone is pointing out. It's going to be option A. Now, let's come to next question. A child presented to clinic with complaints of malnutrition and severe dehydration. A child presented to the clinic with complaints of malnutrition and severe dehydration. They're telling you it's severe dehydration. What will be the choice of IV fluid? So we discussed first is RL with 5% dextrose, then RL, and last is NS. So we discussed this. It is RL with 5% dextrose, followed by RL, followed by NS. This is the sequence. So here the answer is very easy. It's going to be what? It's going to be option C. It's going to be what? It's going to be option C. Now, next question that I'm going to discuss. A 3-year-old child came in OPD with severe diarrhea. So they're telling you severe diarrhea, not dehydration. They're severe diarrhea. Deeply sunken eyes, no urine output. On examination, child is severely dehydrated, lethargic, high respiratory rate, BP of 80. Which fluid is given? Which fluid will be given? So again, this is nothing. This is the clinical variant of the last question. If we go to this question, if we go to this last question, this question had directly asked what is the choice in severe dehydration. ये वाला क्वेश्चन जो है, अभी वाला जो क्वेश्चन है, जो नेक्स्ट क्वेश्चन है, ये वाला जो क्वेश्चन है, ये थोड़ा घूम फिर के पूछ रहा है तुमसे क्वेश्चन. पहले बहुत सारा डिहाइड्रेशन, initially they gave a lot of content about severe dehydration, and then finally again asking you the fluid of choice in severe dehydration. So you again understood this. What this is again going to be RL with 5% dextrose. This is going to be option B only, as everyone is pointing out. This is RL with 5% dextrose only. Which of the following? Next question is, tell me the answer to this question. Which of the following would be more likely in marasmus as compared to Kwashiorkor? Which of the following would be more likely? In marasmus as compared to Kwashiorkor? So everyone is answering it correctly. So question is asking which is more likely in marasmus. It is asking. So a lot of questions are a little bit English play. So they're asking which is more likely in marasmus as compared to Kwashiorkor. So you have to figure out the sign which is there in marasmus, not in Kwashiorkor. So edema is where? Kwashiorkor. Lethargy where? Kwashiorkor. Flag sign where? Kwashiorkor. Irritability where? Irritability where? Marasmus. Irritability where? Marasmus. Irritability where? Marasmus. Right. So correct answer to this question is going to be what? Is going to be option. Is going to be option C. It's going to be what? It's going to be option C. Is going to be exactly. You have to figure out the odd one out. You have to figure out the odd one out. All right. So questions, I'm just discussing 5 to 6 questions this time. All right. I'm just going to teach you 5 to 6 questions at this particular point of time. The the goal was to make you guys understand the MCQs are not tough. The MCQs are never tough. They're easy MCQs. Especially in FMG, for those who are preparing for FMG and joined with the FMG intent, the MCQs are not tough. If you have the concept clear, if you revise that concept once or twice, you will sail through. Just remember the core concept. Oh, some dehydration means ORS only. Severe dehydration means IV fluid, which IV fluid? RL is 5%. Literally with just three concepts, you are able to solve all these are previous year questions, important previous year questions, which have come again and again, Okay. These questions have been repeated not once, multiple times. They have been repeated not once, but multiple times. And every time a question like this comes, just think about the basic core concept and you'll get to the answer. All right. Exactly. Manushri is everyone true. Manushri is absolutely right. Don't overthink. This is simple. This was a very simple question. Which of the following is more likely in marasmus? They are simply asking you what is going to be there in marasmus. Plain and simple. Don't overthink. Don't overthink. That's it. All right. Now, we'll do a little bit more MCQ discussion 1 week later, where I'll be discussing more 15 to 20 more MCQs. Today, I wanted to keep the MCQ a little smaller. I wanted to teach you guys, understand that Kwashiorkor marasmus is not protein calorie. It is visceral in Kwashiorkor, somatic in marasmus. M for marasmus, M for muscle, M for somatic protein. You understood that concept, everything will become easy. All right. I'll practice one more question with Holiday-Segar formula. Fair enough. Let's do that. Let's do that. I'll tell the question to you. A 2-year-old child has come with what? Has come with severe dehydration. A 2-year-old child has come with severe dehydration. All right. His weight is what? 12 kg. Calculate the maintenance fluid in 24 hours. Let me give you the options. What's going to be the answer here? After giving the options? Just let the options come. Just give me a moment. Let the options come. Now tell me the option. Absolutely. It's going to be option C. Someone rightly pointed out, no relation with this severe dehydration. That's a distractor. Examiner is trying to distract you. He's asking you maintenance fluid. He's giving you weight. So 12 kg becomes what? First 10 kg is what? 10 into 100 is equal to 1000. Next 2 kgs is 2 into 50. It is 2 into 50. It is what? 2 into 50 is equal to 100. So total will be 1000. It will be 1000 plus 100 is equal to 1100 ml. Is equal to 1100 ml. Is equal to what? 1100 ml. That's it. So answer here is going to be option C. Answer here is going to be option C. All right. Let's say someone is asking, let's say the weight is 35 kg. Let's say the weight is 35 kg. Fair enough. Let's say the weight is 35 kg. Let's calculate our maintenance fluid or something like that. All right. Let's someone has rightly pointed out. Let's assume the weight is what, 35 kg. Let's say the weight is what? Let's say the weight is 35 kg. First 10 kg. 10 into 100, 1000. Next 10 kgs. 10 into 50. 50 ml per kg, 500. Now from 20 to 35, it is 15. 15 kg, right? So 15 into 20 is equal to 300 ml. So total is going to become what? It's going to become 1800 ml. So everyone, exactly, everyone is getting it correct. Yes, you can use it for adults also. Who said we cannot use it for adults? In adults, after a point of time, the difference is only 20 ml. That's why the difference doesn't vary a lot, but it can be used in adults also. It can be used in adult also. It can be used in adults also. It's used in adults also, right? So this is how we calculate the maintenance fluid. This is how we calculate the maintenance fluid. This is how we calculate the maintenance fluid. All right, it's going to be 1500 ml. So how is it 15 into 20? Someone asked me. Beyond 20 kg. Remember, let's discuss this. Let's see. I told you, right? After 20 kg, it is 20 ml per kg. After 20 kg, I told you, like, I'm coming back to the slide. After 20 kg, it is 20 ml per kg. After 20 kg, it is 20 ml per kg. All right. So we took an example of a 35 kg. So 35 minus 20 is equal to how many extra above 20 is 15 kg. It is 15 kg, right? So 15 into 20, 20 ml per kg. 15 into 20 is 300. So 1500 plus 300, 1800. Right? So this is how you calculate. All right. See, I guys can talk to you. I can teach you guys a lot. It's not that I cannot teach you a lot. The goal of today's session was that for every concept that you might feel is a little bit of rote memorization, there will be a little bit of concept. Right? As far as teaching is concerned, I probably would be taking a one-shot session, definitely. Teaching, I can teach you for 3 days, 2 days, 3 days, 20 hours, 30 hours. That's not the point. And everyone will have an individual request. Someone will want SAM, someone will want milestones, someone might want growth, someone might want cystic fibrosis, like that. Unfortunately, that is not possible today. So let me stick to this. Milestones, I will probably cover at some other point. Definitely I'll cover, because a lot of time you will definitely cover about milestones. I will definitely cover on my YouTube channel, or definitely I'll take another live session covering milestones. No doubt about that. I will definitely cover milestones. That's a common request. But the goal of today's session was to tell you how to use concepts to solve MCQs. Right? Over the next 3-4 days, you'll be getting a set of MCQs. You'll be getting a master question, a master quiz, in which I would be giving 20 questions from my own side. 20 high yield questions from my own side, and I'll be discussing those 20 high yield questions. All right. And in that, I'll discuss milestones also. Don't worry. Right. So if you feel that milestones not covered, I'll discuss those milestones. Don't worry about that. All right. And someone is saying, can I ratify it? Yes, you can ratify it. A little bit of milestones definitely is ratification. No doubt about that. But I'll try to simplify milestones also in the next session that we do. All right. Right now, the goal basically was to teach you that anything that which feels rectification also has concepts behind it, and you can use those concepts to get any question correct.